Allodoxaphobia, fear of opinions. When people live with opinion phobia, they are constantly worried and anxious about hearing other people's opinions about them. Many people realize that their phobia is irrational and unfounded, but they cannot overcome it. This leads them to limit themselves greatly. People of all ages can be afraid of receiving opinions from others. Not only adults, but even young children can suffer from this fear. Allodoxaphobia, fear of opinions. Allodoxaphobia is considered to be derivatives of doxaphobia, but have contradictory meanings. While doxaphobia refers to the phobia of expressing opinions, allodoxaphobia refers to the phobia of hearing others' opinions. Term allodoxaphobia is derived from the Greek words allo, which means different, dox, which means opinion, and phobia, which means fear. As a result, people tend to avoid answering questions or participating in any activities that could potentially cause judgment from others. Causes of allodoxaphobia. There are many people who fear they will not be able to speak their minds, while a small group simply does not want to listen to the opinions of others. Opinion phobia is usually caused by negative or traumatic experiences in the past, the same as other social phobias. Growing children are often triggered by caregivers, teachers, or parents. A child might be suppressed if they are constantly given words of caution or criticism. In addition, traumatized or abused children are more likely to develop allodoxaphobia. Symptoms may include sweaty palms, increased breathing and heartbeat, feeling nauseated or sick, feeling angry whenever a bad or good opinion is expressed, lack of self-esteem, feeling insecurity. Individuals suffering from this condition are simply afraid of feedback. As a result, such individuals are likely to withdraw socially and might even be depressed in some cases. Overcoming and treating the fear of opinions. A therapist can help an individual with allodoxaphobia control their response to triggering factors once the underlying cause has been identified. Typical therapies used for this include group therapy, psychotherapy, systematic desensitization, psychotherapy, counseling, hypnotherapy, etc. Psychiatric medications for allodoxaphobia. Anti-anxiety medications. Preventing panic attacks is very easy with these types of medications. People with phobias and panic attacks often have anxiety disorders, making these drugs extremely useful for those suffering from severe allodoxaphobia. Valium, Xanax, and Klonopin are some common anti-anxiety medications. Antidepressants. People suffering from anxiety disorders, such as allodoxaphobia, can also benefit from these types of medications, not just those with depression. Antidepressants such as Zoloft, Paxil, and Lexapro are among the most common. Allodoxaphobia may be relieved by these drugs. Cognitive behavioral therapy. Psychosocial interventions, such as cognitive behavioral therapy, aim to improve a person's mental health. As a treatment modality, it is often used to treat people that suffer from conditions such as generalized anxiety disorder, phobias, and obsessions. There is also the possibility that someone with allodoxaphobia could benefit from cognitive behavioral therapy too. Mindfulness-based stress reduction. Mindfulness-based stress reduction is an 8-week evidence-based mindfulness program that provides secular, intensive mindfulness instruction in order to help individuals who suffer from anxiety, stress, depression, and other kinds of mental discomfort. As mindfulness meditation has been shown to be very beneficial to people who suffer from anxiety. Meditation. There are many different types of meditation that are beneficial for people who suffer from allodoxaphobia. It has been shown that mindfulness meditation helps people become more equanimous by helping them gain sense of inner peace. The best way that anyone can implement mindfulness meditation to relieve their symptoms of allodoxaphobia is by developing the ability to pay close attention to the way that the muscles in their abdominals and chest contract and relax with every inhalation and exhalation. Exposure therapy. The treatment of anxiety disorders such as allodoxaphobia with exposure therapy is very common. Using this method helps desensitize the patient to their particular fears. Regardless of the case, it is vital that the therapist implementing it with the patient is very skilled at doing so. Allodoxaphobia management's tips. Exercise. Those suffering from anxiety disorders, such as allodoxaphobia, can benefit greatly from exercise. Aerobic exercises, in particular, can significantly reduce stress levels. It has been proven that aerobic exercise is a better option when it comes to releasing those happy hormones in the brain, such as endorphins. In order to help relieve the symptoms of allodoxaphobia, there are many different aerobic activities that can be performed, such as swimming, biking, skiing, walking, and jogging. Practicing yoga for allodoxaphobia. Allodoxaphobia sufferers can greatly benefit from a variety of yoga poses. Yoga can induce a meditative state of mind in some people who practice it regularly. This is similar to meditating while moving. Many different types of yoga are beneficial to people with allodoxaphobia. Reducing caffeine for allodoxaphobia. Caffeine consumption can make you more anxious if you consume large amounts through the day. If we examine caffeine's physiological effects closely, we can see why this makes sense. The high dose of caffeine will cause us to become more tense and our hearts to beat faster. In essence, our body will start to go into a fight or flight mode. Individuals with allodoxaphobia often experience panic attacks when they are in this frame of mind. Dialectical behavior therapy for allodoxaphobia. People who are struggling with emotion regulation benefit greatly from dialectical behavior therapy. People suffering from borderline personality disorder often use it to treat their disorder. Nevertheless, anxiety disorders like allodoxaphobia can also benefit from it. To know more or get support for allodoxaphobia, reach out to www.teletherapies.org. Thanks for watching.